I don't care how y'all do it, y'all just gonna tell them about your patient and what you did and what they're on and what you see, okay? We're studying for Pharm, remember that.
Our patient has Addison's disease, COPD, and she's on, prednisone,
Prednisone. And what is
for
it?
her COPD.
Y'all remember, we gotta know classes, so what is prednisone? Okay, glucocorticoid.
And they would take it with food for GI, except, take it as prescribed, don't rush it, don't stop it suddenly, avoid alcohol, be cautious with vaccines, and stay away from contagious people.
Why?
Um,
Because what is a glucocorticoid?
It's a steroid.
So it's an anti-inflammatory, which is the same thing as an anti-immune.
And notify the doctor of any joint pain, swelling, or tarry stool, and check the blood glucose levels.
So what do we know the adverse reactions are gonna be? Just from what she just said, I ain't asking them, I'm asking y'all.
Lowered immune system. Sure,
Lowered immune
inflammatory
system,
responses.
GI bleeding,
I'll-
elevated blood sugar.
Prednisone makes me hyper. Well, everything
But-
makes me hyper.
Y'all got all that? Not only my adverse reactions, cause I just read your test. So if I'm asking y'all questions, it's cause I know you're gonna see it on the test.
And our patient also has pink eye. She got it virally. So all we can do for that is a cold compress. Make sure you use a clean towel. Wash it out every time. Get a new one every time that you go to clean it. We also,
So how'd she get a
over-
viral eye infection?
she got it because that nurse came to work with a viral eye infection. I don't know, you said just they, I don't know.
So
we
she
got it.
you didn't wash your hands?
Not me.
Remember, infection control's on y'all's test tomorrow.
Yet, one of us did not wash our hands and we
She
touched
rubbed
the
your eye,
patient.
and you rubbed your eye on.
Extremely contagious.
How does that help us
Extremely
as far as
contagious.
eye drops? What do we need to know about eye drops?
We were getting over-the-counter eye drops for the artificial tears to help.
But on administration, what do you have to do to try to prevent getting a eye infection?
Hand wash.
Don't let it touch the eye.
Don't touch the thing to your eye, do we? Yeah, thank you. That's a test question. You know, about,
I'm gonna get down.
do you put it in your eye, do you stick it up your nose, do you let it touch your ear? I'm gonna ask y'all this kind of question.
She also has pancreatic cancer. She's on IV chemo. She's on,
So what, we don't even care what kind she's on, what adverse reactions is she experiencing immediately?
GI.
No,
So
you're
what, no, okay, and then, intermediately, what are we gonna have to check on her, cause she's on a really potent
Her
chemo?
blood count,
Her
white blood count.
And then long-term, what am I gonna have to monitor her for, because she received the chemo? What kind of long-term reactions would I have to monitor her for?
Depending on the age, like fertility and stuff like
She's
that.
Could be
78.
Oh, she's
fertility
78.
or,
She's not having kids.
so 78, what would I worry about, what would I watch for,
Infection.
long-term, long-term after chemo?
Bone marrow depression.
Hair loss? No.
It could be kidneys, and cardiotoxicity, neurotoxicity, renal toxicity. So long-term is organ damage.
Okay.
She also has multiple,
Skin tears,
Skin tears,
which
yes.
could be caused by the prednisone, is that, okay, because it can, cause fragile skin.
And what are y'all doing to treat her skin care?
We're using, glucocortisone, which is an ACH inhibitor. ATCH, sorry. That treats the burns, wounds, pressure ulcers, and
So why are we
also
putting that on?
multiple skin tears.
Why are we putting it on her? It's to, what's the reason for the cream?
Because of her skin tears.
Okay, but why are you applying a cream to her skin tears? I don't know, I'm asking you, are y'all giving her that drug to heal it or prevent infection, or what's the use?
To prevent the infection.
Okay.
So she won't get it because she's already.
And what kind of adverse
susceptible.
reactions is she gonna have to the ointment?
Burning, transient burning.
And what kind of, hypersensitive reaction would we watch for?
Rash.
Thank you.
I won't.
Are y'all getting what I'm trying to do with y'all here? Y'all looked it up, and so I'm asking her those questions, and they are not identical to what's on the test, but it's the same gist, okay? So y'all did your chemo, your glucocorticoid, and now she's got Addison.
No. All right, keep playing. I'm gonna call you
And
mom.
y'all, if you wanna know what, y'all ever seen that movie, Something About Mary?
Yes.
You remember the lady, her lady that lived in the apartment spire, her friend?
Is that her?
You know, she had the dog that they set on fire and all that on
Wait.
accident. Have y'all not seen this movie?
Stage 4 pressure ulcer with necrotic tissue on his coccyx, and then earwax, and he's on chemotherapy.
And y'all spilled the
And we
chemotherapy.
still have chemotherapy.
We did spill the chemotherapy.
Okay, so what did you have to wear to clean it
So we
out?
put on some PPE, it's like chemotherapy kind of PPE.
What's chemotherapy?
I don't know, there was a bunch of stuff kind of like chemotherapy gloves, they were like really thick gloves.
Were
And then
they
we had to
face
put on
shield,
utility
regular,
gloves.
like vinyl or?
They were just thick, I don't know, I didn't.
You had to put on 2 different sets of gloves.
Yeah, it was that and
Just
then
the
the other
chemotherapy.
one.
Yeah, and just so y'all know,
And utility
they
gloves.
usually use like neoprene or plastic. They can't use like, you can't get it through your gloves.
The gown and shoe covers and face shields, and then you need to have the hazard bags and disposable towels, and whatever the pillow thing is there that sucks it all up. That's all I got.
That's it. That was my main thing, is that
Oh, and
y'all
then we're gonna-
understand. You have to wear some special PPE if you spill the chemo.
Also, afterwards, we clean the floor with 10% bleach solution, followed by 1% sodium thiosulfate. Thiosulfate?
Y'all,
thought
when
we
I used
couldn't
to-
use
Wash with detergent on the floor. That's it.
when I was doing that home infusion stuff with Indy Anderson, like, we'd give Adriamycin, which we call Red Devil, and we would give it in their chest, in one of the implanted ports. So you insert a needle into the port, put on these big rubber boots, rubber gown, rubber gloves, mask, before you could be around the patient. So that's a picture. Get it right. I'm joking.
You can't touch like his, any kind of body, because it's like, he got the drug in it. So like his daughter was doing something for him, I don't know what it was, and I think it's what, she's putting it up. So she's supposed to do it,
We're
she
not
can't
talking
touch their hands, they drug that one,
Okay, so we had crazy earwax, and we used the carbamide peroxide drops.
We just call it Cerumenex. So what does Cerumenex mean? Cerumen's
So we're
what?
taking out the
Cerumen and earwax.
Okay.
The foaming breaks up the earwax, it softens, loosens, removes, our adverse reactions, so
So how many days did y'all get to use it? Say that out loud 3 times.
No more than 4.
No more than 4.
No
No more
more
than
than
4.
four.
No more than 4. And it's the what? Say the name of it again.
Well, it doesn't even matter what the name is. What am I gonna have beside it?
No more than
Something to remove earwax.
Oh. Adverse reactions are rash, itching, burning. You fill the ear canal, insert the cotton plug. Allow to remain for 15 to 30 minutes, and then you flush the ear. And do not touch the dropper to the ear.
Very good. Do you always put cotton balls in?
No. But when new, you only have to.
If they order it. Okay, so we did the chemo and that. What did y'all do for the mouth ulcers that your patient got after the chemo? What would you do for mouth ulcers that your patient gets after chemo? So we do meticulous mouth care, right? And what do we use? Do we use those lemon glycerin swabs?
No.
Why?
They're gonna burn.
They're gonna burn.
So what would we use?
Saline.
Normal saline.
And I say when people have questions about that. And then what was y'all's other problem besides the chemo?
We had diabetes insipidus. It caused an imbalance of fluids in the body. What did we do? She was on a antidiuretic and diuretic. And
Antidiuretic hormone called. There was only one of them.
You knew it.
Vasopressin.
Oh, I said it earlier. Yeah, I didn't know it. And some reactions and stuff for your like polydipsia, polyuria. You need to consume about 2 liters or 20 liters of water to flush out all the urine and stuff because it's like constant
What is
urinating.
diabetes insipidus?
Constant like urinating. Like just
Okay.
Fluid out of
You
all your
lose
pores.
all your fluids, so what'd you have to do to treat it?
Keep
Give them the antidiuretic hormone so that causes the body to do what?
Retain water.
retaining.
Or hold on to
And
it.
that's another word for retain.
Conserve.
Exactly, I knew she would do it. Yeah, it just tells your body conserve water.
So they stay thirsty.
And when we give them something to make them conserve water, what do we have to watch for?
Dehydration.
Water toxicity.
Water intoxication. That's what I was going. Water jump. Sorry, I'm just trying to make sure.
What was the name of it again?
Vasopressin.
I don't really remember where I was at, but if you need more stuff, you ask me now. I don't know.
Come on, watch, what'd you give me name?
I don't remember where I'm. Okay, drink enough fluid to replace urine walls. The urine is gonna be colorless.
He's not talking about with the drug, he's talking about with diabetes.
And you have to check for
Yeah,
chemicals.
I'm not talking about the specific drug. I think that's pretty much it. But I have a lot of. I don't remember what I was saying.
You did good, you were
started
talking
I was listening, and I
about, you were
forgot.
talking about diabetes insipidus. I'm telling him your Pharm test is over the drug you would use.
The
to treat
diuretic
it.
and diuretic. Yeah.
ADH, antidiuretic hormone. When we give it as a drug, we call it vasopressin. DDADP.
She also had stage 4 pressure ulcers, and we use a corticosteroid topically, and
Why? What is a corticosteroid ointment gonna treat? Inflammation. She has a necrotic wound. It has necrotic tissue. So what are you gonna have to use? Are you gonna wanna use something for inflammation?
You're gonna need something to get the tissue off.
So you need a debrider. So you need a, I'm trying to think how it says it in your notes. Enzymatic. In y'all's notes, it talks about topical enzymatic. And it's just, there's an enzyme in the ointment that eats the dead tissue okay? And literally, if you were to put that dressing on that patient with that ointment, and you take it off, it like melts it. So you get this nasty drainage, it's just where you melted the dead tissue. So you would use an enzymatic, not a corticosteroid. And think about that, I use a corticosteroid and it increases their risk for infection. So now I put that on an open wound, what am I putting her at risk for? So, you would say, do not use a corticosteroid on the wounds. What would you use a corticosteroid on, because you looked it up, think about it.
So then there'd be a stage 1.
No, think about, what were you gonna use cortisone cream on? You use it on a wound?
Insect bites.
Exactly. Because what's it treat? Inflammation, which is itching and redness and, yeah. That's what a corticosteroid is. Does that make better sense?
Yeah, that makes sense now.
Yeah. That's a good example of what I've been trying to tell y'all all along. Quit overthinking and just looking at it like, I have to look at this name, da-da-da. Just stop and think. If I know what a corticosteroid's for inflammation, then I can ask you without you looking at a book what you're gonna use it to treat, and you know right off the bat. If you know that it's an anti-immune as well as an anti-inflammatory, because it's the same thing, what adverse reaction would I watch for if I was putting cortisone cream on an insect bite?
Information.
Infection.
Oh, infection.
You know, the bee stings you, so you put an anti-inflammatory like cortisone on it. What do you watch for? You look to make sure you don't have infection at that site because you just put an anti-immune drug on it. Does that make sense? That's simple. Okay, good. Sorry. I break in because this is, I'm trying to help our study.
And the chemotherapy for the bone cancer, it, side effects would be nausea and vomiting.
When do we treat the nausea and vomiting?
Beforehand. To give them fluids with the IV infusion to prevent dehydration. It lowers the body's immunity, and it's also, really hard on the kidneys, so always check the input and output in kidney function.
And your patient lost their hair. What you gonna tell them to do? Exactly. That was the answer. It's that simple. Please do not miss that on the test. Why would we want them to wear a hat or wrap their head? Not sun exposure. Heat loss. And when we lose heat, what does that speed up? Metabolism, okay? And what is, this person's body is working overtime to try to heal itself, so we don't want to add anything like trying to keep itself warm or whatever. So it's a good way to think about it. But if something asks you about what do you tell your patient that lost their hair, what are you gonna tell your patient that lost their hair? Wear a hat or cover your head. It's that easy. There was something else I was gonna ask you on there. It'll come back to me in a second. Keep going.
She developed Cushing's disease, which is a serious condition of an excess of the steroid hormone cortisol in the blood level caused by a pituitary tumor secreting adrenocorticotropic hormone. We think that is what made the pressure ulcer so bad. It leads to very, very thin skin and slow healing. So it kind of made a big circle and made the pressure ulcer worse. So we stopped using cortisone and used the enzymatic instead to treat it.
And on the Cushing's, why'd she get Cushing's? Because she had a tumor?
She had too much cortisol, essentially.
Was it something she took?
It was medication for the pressure ulcer.
And y'all, she had bone cancer, and I'll tell you, one of the first things that we do when we have cancer, we talk about the inflammation and all that kind of stuff. A lot of times we have to put them on steroids and high doses of steroids, and that leads to Cushing's. So, The steroid, the most common one, and y'all probably are all, if you're like me, that them gave you either solumedrol or prednisone, little dose packs. So if I start growing weird here and get a buffalo bomb, y'all need to send this go. I don't think I have a buffalo. But remember that. Fluid retention, buffalo hump, moon face. Moon face, buffalo hump. I don't know how to make a rhyme. Cushing's, I don't know, maybe it's Cowboy Cushing has buffalo hump.
It's just a hump.
I like
A
it.
moon
There you go.
face.
Good one.
Cowboy fishing.
Yeah.
Well, y'all won't forget it anyway. That,
Girl, whenever you see with the people with
He has glaucoma, and to help with the glaucoma, we're gonna give him some eye drops.
what's the purpose of that
The purpose of giving him eye drops?
for glaucoma?
It's gonna help him release the fluid, whatever the fluid's called, and therefore it's gonna decrease the intraocular pressure.
Y'all say that 3 times.
Decrease the intraocular pressure.
Just decrease intraocular pressure. Decrease intraocular pressure.
I just know pressure, decrease pressure. That's what I know to do.
So he doesn't really have like a lot of adverse reactions besides like near his eyes and stuff like that, and it's usually like itching and stuff like that if he does have them, or blurred vision, and
You know what it feels like when you get an eyelash in your eye?
yeah, foreign body sensation.
Say that 3 times.
Foreign body sensation, foreign body sensation,
Foreign body sensation.
foreign body sensation, and burning. When you give him the eye drops, make sure that you don't touch, the dropper to his actual eye, and hold it in your hand, like the bottle, and
Where do we
warm it.
administer it at?
Where?
Uh-huh.
I wrote it down, hold on, give me a second.
It's the lower lead.
In the middle of the lower, the conjunctival sac.
Uh-huh. Why don't we put it in the tear duct?
Why? Like, why not?
Yeah, why wouldn't we put the drops right there in the tear duct?
It causes a systemic effect,
Say that loudly.
because it causes systemic effect.
In fact, sometimes when we give eye drops, if we don't want to cause, we want to lessen the risk for systemic effect, we put pressure against the
Is it this thing?
eye drop. Yeah, just take your pinky and put a little pressure to keep it from going.
Is it might cause a
Systemic.
This says sometimes it's, some eye drops are contraindicated with soft contacts, so, he's not wearing his contacts. And if he did, we should wait to put them back in for 15 minutes, and
When do we give his second medication?
5 minutes, wait 5 minutes before
Say it
giving
again.
the second.
Wait 5.
Wait 5 minutes before giving the second.
Me too.
And this also says that it could change the color of your eyelashes or your iris. So I thought that was something that stuck out. And yeah, I think that's the important stuff.
It was really important.
Okay, so our patient Jeffrey, he also has diabetes, type 1 diabetes, and we're gonna be giving him insulin because we need to replace his insulin because he doesn't have it. The complications of it's not like super serious. It can cause hypo or hyperglycemia and also allergic reactions. Some nursing interventions, you're gonna wanna make sure that your patient is eating, like you don't want them to be like not having food in them and then giving them insulin as well. You're gonna assess their skin and mucous membranes and extremities, and this is gonna be like any sores and cuts. And just a little side note, our patient does have some sores on their belly, so we're gonna monitor those like very closely.
Oh, what caused the sores?
What do you mean?
Well, you said he had sores around his belly. Why did he get sores around his
He's like
belly?
really fat.
Yeah, he has infected,
He be sweating right there.
It's his
Oh, he's got yeast in his skin folds.
and that is hard to get rid of.
So we're gonna monitor those very closely because the healing, whenever somebody has diabetes, it's very slow. So we're gonna monitor that. We're also gonna be rotating his injection sites whenever we give his insulin. You also want to educate your patient on how important it is to monitor his glucose. And then you're gonna also explain his diet because he needs to be on a strict diet with his diabetes. So.
Okay, so he has infected yeast skin holes, and we're putting a topical antifungal on it. And we're just.
Did
the
you use your
antifungals are
hands or
gonna-
a stick, or what'd you use to put it on with?
Huh? A swab.
What'd she say?
I didn't know.
Sounds
so-
good.
okay.
And you also wore what?
We're cleaning the skin, we're drying the skin, and we're applying antifungal drugs.
Do we put a dressing over that?
And we're,
Why?
let it bleed.
Thank you. That's good. Somebody answered something. And we don't always cover, when we have a topical cream we put on stuff, some of it you cover and some of it you never cover, okay? Well, like if you were worried about an infection, what would you do?
Does this make sense?
Put a Band-Aid on it, right?
Okay.
Okay, so he also has thyroid cancer, so we're gonna give him radioactive iodine, which is a serious drug. Like, you basically have to turn into a hermit for a few days.
So how far away do y'all need to stand? Cause y'all all look like y'all are of childbearing age.
I'm not in the room right now,
Okay.
and I may be of childbearing age, but I am done, so I don't care.
Just stand closer to it.
Yeah, right, no, me too. But no, he would take, if he were already on anti-thyroid drugs beforehand, he's gonna stop those 3 days before he gets the radioactive iodine. He's gonna take it, go home, lock himself in the room. We do need to teach him to flush the toilet twice. Stay away from children, pregnant women. It can cause, I don't remember the big fancy words, but basically it's gonna cause you to bleed more, anemia. And also it's gonna lower his white blood cell count, so we really need to watch for infection.
Leukopenia and thrombocytopenia.
That's it. So, because, and the radioactive iodine, it's gonna destroy like your whole thyroid. So therefore,
So since he doesn't have a thyroid properly functioning anymore, he's going to be on thyroid hormones for the rest of his life. And
a side effect of that would really the only one I can think of off the top of my head is hyperthyroidism.
yeah, he's gonna
because
be,
too much of a good thing.
yeah.
So,
And when do they take that?
the thyroid in the morning.
Before breakfast.
And he has grave fungal eye infection, ear infection, type 2 diabetes, multi-medication regimen, he's on an anti-diabetic, and then he has liver cancer, and he also has
A goiter.
Okay, so to start off with the fungal eye infection, he complained that it hurt really bad. So we're gonna give an antifungal eye drop named natamycin. The adverse reactions are pretty rare, so it's mostly local, which is, you know, your itching, burning sensation. You're also at risk for a super infection because it is you're given an antifungal.
What's a super infection?
it's
Bad.
where you get another infection.
Yeah.
It's drug induced. We wiped out the good stuff.
Okay. So now, well, pretty much you already know that the eye droplet shouldn't touch your eye. That's risk for infection. Risk for infection. Okay. So now I'm gonna go over to the ear for the ear infection. I did an antipyrine, which is an analgesic to relieve pain for the ear infection.
Did y'all hear that? Analgesic means what?
Relieve pain.
Say that 3 times.
Analgesic means to relieve pain. To relieve pain. Analgesic to relieve pain. Okay. Also, adverse reactions is ear irritation, itching, and burning.
How do you put the eardrops in?
Well, for an older patient, we're gonna pull the ear back, tilt them to the side, and dip it. But if even though we're not working with children, if it is a child, your ear's gonna go lower, pull lower. Yeah, I think that's it for now.
I got anti-diabetics, and our patient is he takes multiple ones, so he's at a high risk for hypoglycemia, and that means his sugar's really high, right? Yeah, his sugar's really high. So in order to combat that, you're gonna titrate the dose of the drugs. But we can't do that, right? The doctor gotta do that. Yeah. And it's contraindicated in patients older than 80. So somebody older than 80 can't take it. And most of the meds are taken with meals, either with meals, 30 minutes before meals, or 30 minutes after meals. And the SLGT2s are taken at the same time every day. And if you miss one, you have to take it as soon as you remember.
Okay, so he has, I gave him an anti-thyroid drug for the Graves and the goiter. So the adverse reactions that he would have would be like a fever, sore throat, skin rash, headache, nausea, vomiting, and then numbness and tingling. And this way is what's it called? Paresthesia. Okay, so the risk that he could have is risk for infection, risk for impaired skin integrity, risk for in therapeutic regimen management, ineffective.
He's not taking it like he should.
Okay, and then what I'm going to be looking for is his allergies, like if he have any allergies with iodine and seafood, because I wouldn't give the medication then. And then on the ongoing assessment, I would do a test for his blood test and look for the signs of the infection. And the signs of the infection is fever, cough, fatigue, and decreased blood cells.
Y'all need to know the signs and symptoms of infection and inflammation for both tests.
And then what I will teach him is to avoid the use of non-prescribed medication, and then take the drugs given to him regular, and do not alter the dose. And for him, you do not palpate the thyroid because it can cause thyroid storm, and a thyroid storm is
Thyroid toxicosis. Very good. Hurry, you got one?
Okay, so he also has liver cancer. So you pretty much give him a anti-neoplastic, which is of course for chemotherapy. But because he has liver cancer, you already have to use it cautiously with those who have liver impairment. Am I on the right track?
His oral anti-diabetic agents have to be very
Yeah,
careful.
that's the one.
Because they cause liver toxicity.
Yes.
That was why I gave you liver cancer and oral anti-diabetic.
Right.
We'll have to really monitor closely which functions, which we gotta monitor with all drugs, but
Right.
that one really closely. What two body functions do we gotta monitor?
liver and kidney.
Liver and kidney, there you go.
So yeah, that's pretty much it.
Monitor the
Diabetic. You're gonna assess his skin and his mucous membranes and for sores and cuts. The ongoing, you're gonna watch for his adverse reactions and weigh him because it's due to exercise. Hyperglycemia and hypoglycemia and allergic reaction are the adverse reactions, and foot and skin care are very important. And he needs to take his blood pressure.
What do we
Blood
do if he's
sugar every day.
hypoglycemic?
Give him like candy or
Yeah, give him a
orange juice.
What other things do we do besides just orange juice or candy?
Glucose tablet.
Glucose tablets, what else?
For a big glycogen. Where is that?
And look on there, if you see a test question like that, look for anything's got sugar in it,
Sugar.
right?
Alright, they also have psoriasis, so we're gonna use a topical anti-psoriatic. So that treats psoriasis by removing the plaques, and it'll come in either a cream, lotions, or ointments. The adverse reactions are burning, itching, and irritation.
And what do you have to wear when you apply it?
Gloves.
Why? Nope. It will discolor their hair
Oh,
and
yeah.
nails. Hair and
Hair and-
nails, hair and
yeah.
nails, hair and nails. Anti-psoriatic, hair and nails, hair and nails, hair and nails. Got that? Did y'all catch it?
Yes, hair and
Okay.
nails.
Just making sure y'all caught them.
Hair and nails.
And so you just make sure to clean the skin before you apply it, and you should only apply it to the affected areas.
Our patient also has breast cancer and is taking an oral chemotherapy. See, adverse reactions are acne, rash, nail changes, hair depigmentation, so their hair is gonna lose its color. Photosensitivity, thin, brittle, dry hair, nausea, vomiting.
She's
Lung-
going home with it. What do we gotta tell her to do when she has it at home?
She needs to take it 30 minutes.
No, where does she, how does she need to store it when she takes it?
Oh, jeez.
No brainer, don't even look into
I just
that.
have room, I mean.
Would you want chemo laying around your
No,
house?
no, it needs to be up high and put away, cause it's
Clear
toxic.
label.
Yes.
That's it. That was good. That was that's why I gave y'all the oral.
Long-term effects are neuro changes, swelling under the skin, delayed blood clotting, and wound healing. So, it has to be swallowed whole. You can't crush it or chew it. 30 minutes after meals. And some of the one drug I looked up, you cannot take blood thinners or folic acid with it.
Very good.
Okay, he's also got hypothyroidism. It's a decreased amount in thyroids. You can give him levothyroxine. Thyroid hormones increase the metabolic rate of tissues, heart and respiratory rate, body temperature, cardiac output, oxygen consumption, metabolism of fats, proteins, and carbohydrates. And you're supposed to take it before meals.
How do we know it's working?
His thyroid is
Actually, he'll have increased appetite.
increased appetite.
We know it's working when they get increased appetite. When your thyroid's low, you're hungry. You're not hungry, you're sleepy, but you're gaining weight. When you take the medicine, you wake up, you eat all the time, have lots of energy. That's
Adverse reactions is hypothyroidism and side effects, signs of overdose. So it would be really cautious if he's like, yeah.
it's
I
really
don't know the
hard.
word for it, but that's not to use it for obesity or infertility if they've had like a heart attack or heart disease. The doctor may prescribe smaller doses for hypothyroidism. Always before they get administered medicine, always check their weight vitals and ongoing is weight loss, mild duress, increased appetite, increased pulse, decreased puffiness of the face and hands and feet, increased sense of well-being, increased mental activity.
Very good. You could always say, you take the thyroid pill.